This is a journey into sound. A journey which along the way will bring to you new color, new dimension, new values, and a new experience.
Welcome to the Spirit Sessions podcast. I'm your guide, Katie Silcox, bringing you your weekly self-love soundbite. Join us, where I'll help you find your true spiritual home, where every single aspect of you is holy ground. Holy ground.
This is a journey into sound.
This is a Spirit Session podcast with Katie Silcox. Venga chicos, empezamos.
Hey guys, just a quick word from our sponsor. Founded in 2014 by two female Ayurvedic practitioners and named after the Sanskrit term for purity, Pavani Ayurveda takes pride in offering pure products that are made of entirely ingredients from the earth. And here's the thing, you all. Everybody in Shakti school is like, what should I put on my food? What spices should I cook with? Well, here's why I love Pavani. They have solved this for you, okay? First of all, their products are 100% earth-based, organic, wild harvested, certified cruelty-free, gluten-free, paraben-free, chemical-free. You know these girls in California. They're going to do it right. So with products packaged in glass, which is massive for me personally, they maintain the integrity of the herbs with labels printed with water-based inks on recycled paper. Guys, Pavani is really serious about protecting Mama Earth and spreading the wisdom of Ayurveda to the modern world. That's why we get a lot of people that want to be ads for our podcast, and we only work with a few, and these girls are one of them. You can check out their offerings on their website at pavaniayurveda.com. We've got all the links in the show notes to that. And they have everything from dosha-specific skincare, Abhyanga oils, loose leaf teas, herbal supplements, and neti pots. And here's the big news, and this is why I love them. They've created these new spice blends. And what that means is that you don't have to do the work at home. These women did it for you. There's a kapha, a pitta, and a vata spice blend, and there's a tridoshic spice blend. So you can use those if you know about your Ayurveda dosha to balance your gut. And if you don't, you need to join Shakti school. And, maybe we should do a whole thing about understanding your dosha. That's a really good idea. But in the meantime, here's just a really good practice. This is what I do. I don't really eat for my personal dosha. I eat seasonally. And so right now I'm in Hawaii and it's hot. And so I'm using their pitta spice blend because pitta cools and soothes, right? When I go back to Virginia in a month, it's going to be spring. And that's a great time to be working with the kapha dosha. You want to heat it up and purify it. So guys, these spice blends are wonderful, and I can't recommend them enough. All right, more with Pavani in the links, and on to the show. Hi, everybody. It's Katie Silcox, your girl here, with a very special guest. This is our next in a long line of what I hope will be a central series that we have here at Spirit Sessions called Katie Talks with Smart Dudes. And these are not only dudes that are smart, but of course have heart. And Dr. Harry Adelson is definitely one of these men. He is a friend, but for what we are speaking about today, I think he's a real renegade in the best sense of that word in the realm of medicine and self-healing. He has an advanced degree in naturopathic medicine. He's the founder of Docere Clinics in Park City, Utah, the author of the book, The Stem Cell Solution. He's been featured in TED Talks, Mind Valley, Silicon Valley Health, Bulletproof. But most importantly for us, he is a world-renowned expert in the treatment of musculoskeletal pain conditions. Dr. Harry has performed more than 6,000 stem cell procedures and has injected stem cells into more than 1,600 intervertebral discs. And I think that we are all in agreement that Dr. Harry is one of the most experienced in the world with the use of stem cell treatments. And so I'm so excited to have you here, Dr. Harry. Welcome to Spirit Sessions.
Thank you so much, Katie. It's a pleasure to be here with you. And thank you for that very genuine and sincere introduction.
Well, I had the privilege of hearing you speak twice last year, and I was just so astounded. And, I knew nothing about what you do. And the more I learned about what you do and I read your book, the more this light bulb went off in my head. And maybe we can kind of frame it for our listeners who are used to me talking about Ayurveda and the role of emotions and spirituality and our subconscious mind in healing. And when I read your book, I was like, oh my God, like naturopathy is so similar to what we do with Ayurveda. But more excitingly, I realized that stem cells was a synonym for what we call the dhatus, a specific part of the dhatus in Ayurveda. So for those listeners, including myself, please give us a definition of what it is that, before we dive into like the fun stories, like what are stem cells and why are they important in our healing? Why did you focus on that?
Sure. If you don't mind, I'd like to start with, in your introduction, you used the word renegade. The word that I've always used is subversive.
Oh, even better.
and early on, as in high school, and on through college, I was a huge Frank Zappa fan. And if you're at all familiar with the work of Frank Zappa, his work is characterized by this like incredibly complex music that he demanded perfection. But he also had his lyrics, and his lyrics were often very funny and satirical, but they were a very open, direct attack against mostly the entertainment industry, but basically the system as a whole, but specifically, kind of the entertainment industry. And I, when I was at McGill University, I took this course called Food and Nutrition in Prehistoric Societies. And this is back in like 1986. So it was kind of mind-blowing, some of these concepts. And they told us about I remember the professor telling this story about something that actually happened in Canada, where the Inuit people, the Eskimos, basically, they were accustomed to just eating one thing. They mostly seal blubber, occasional whale blubber, and that was like their diet consisted of like one thing. Fortunately, it was something that's very nutritious. Well, then when the pipeline came through and a lot of these guys quit their sort of traditional lifestyle and took jobs and started buying food at the company store, it made sense to them to just live on one thing. So what was the thing that they chose? Twinkies.
Wow.
So the health impact was so profound that Health Canada, because people were like literally dying left and right. So Health Canada had to intervene. And, the instructor was sort of a radical guy. And he was explaining that, this is what the health, what the food industry pushes this, stuff that's terrible for you, because we innately crave stuff that's sweet and stuff that's calorie dense. But, this is what happens. And something about that, like, it clicked for me, because I'd been listening to Frank Zappa's lyrics for so many years. And I wanted to be the Frank Zappa to the food industry. And that's why I went to naturopathic school. So naturopathic medicine is a 4-year doctoral degree that is based on 6 guiding philosophical principles. The first, and arguably the most important, is the healing power of nature. So we're not so much defined by which modalities we use. Some people use homeopathy, some use Ayurveda, some use Chinese medicine, acupuncture. I use stem cells. We're guided by these philosophical tenets. And it turned out that I got injured early on. My first year of naturopathic school, I was a fanatical rock climber, and I injured my shoulder. And I went and saw a surgeon, and he said, well, you tore a piece of cartilage in your shoulder. I can put a scope in there and cut it out. it'll probably help in the short term, but it's probably going to give you problems later in life. Or I can give you a steroid injection, which will likely help in the short term, but it actually will further degrade the ligaments. And I thought, those are my choices? Like, that's it? So I started really digging into what naturopathy had to offer. And it was, it was a frank tear in my cartilage. So it required something a little more interventional than just like nutritional guidelines or something like that. So I found out about Rick Marinelli, who was the first naturopathic doctor to perform prolotherapy. And prolotherapy, it's helpful to understand the idea behind it, because really it was the predecessor to stem cell therapy. So prolotherapy is the injection of natural substances that are simultaneously nutritive and slightly irritating, most notably sugar, dextrose, injected into the area. It essentially tricks your body into thinking that it's been re-injured without actually having caused any tissue damage, thereby launching the body's natural healing cascade. And I had it done to me, and it worked so well that my life path unfolded before me. And I did prolotherapy for my first 6 years, and I thought that's what I would do. My office was slightly more complicated than an acupuncturist's office. And then platelet-rich plasma came along. So platelet-rich plasma is you take a patient's blood, concentrate down the platelets. Blood consists of the white blood cells and the red blood cells. It consists of the serum, and then it has these platelets. And platelets are what are responsible for activating your own stem cells. When platelets get released outside of blood vessels, they recognize that they're outside of a blood vessel, and they release this growth factor called platelet-derived growth factor that triggers your endogenous stem cells, the stem cells existing in your body, to activate and to like basically boost a healing response. So then we started using PRP. PRP was a little more complex. It involved some expensive equipment. We started using ultrasound guidance. We started for the first time really start getting sort of icicles from the MDs. Before with prolotherapy was so alternative that the MDs doing it knew they were doing alternative medicine. So they warmly welcomed the naturopaths. When PRP hit and the surgeons started getting interested in it, and there was some talk about insurance covering it, and now it was sort of into the medical realm. For the first time, the naturopaths really felt icicles from the MDs. Well, then in 2010, a patient came to me, a woman that I've been treating for years, who you'll like the story. I'd helped her over the years for, doing prolotherapy and then PRP. She had this very bad knee injury, and it just, her knee was quite badly damaged. And we treated her over the years, and she got better, but I just never got her all the way there. And she came into my office, and she put down a stack of papers on my desk, and it was all scientific articles on using bone marrow stem cells for the treatment of knee arthritis in animals. Because back then in 2010, that's all there was when it was animal studies. And this woman said to me, I want you to put bone marrow stem cells into my knee. And I said, Laura, I don't know how to do that. And she said, so learn. And I said, Laura, I'm a naturopathic doctor. Like, do you know how much criticism I'll get if I start doing bone marrow aspirations? And she said, Harry, I'm a materials engineer for NASA, and I'm a woman. So if you want to complain to me about people telling you that you're out of your league, I'm afraid you're talking to the wrong person. And I really, I had no response for that. So I found a surgeon willing to teach me how to aspirate bone marrow, and I started doing it, and it worked so well that I knew this is all I wanted to do. So stem cells, back to your original question, stem cells exist in our body in all the tissues. Pretty much all the tissues in our body have their own population of stem cells. And what makes a stem cell, the very definition of it is it has the ability, when it replicates, when it divides, to either turn into a new version of itself or turn into a target tissue, like in cartilage or bone or fat or ligament or whatever. The other thing that stem cells have the ability to do, sort of their other superhuman power, is they have the ability to communicate with damaged cells and tell them to heal. So, and that's where we use it therapeutically. So say somebody's had either a serious traumatic injury that doesn't completely recover, or over the years, just from like multiple small injuries, what do you want to say, like repetitive type overuse injuries. Similarly, the structure of those tissues, the microscopic structure, changes. And when it changes, it becomes pain generators. And that's really the key with most low back pain, most neck pain, most joint pain. These are actually changes in the microscopic anatomy. These are basically like non-healing wounds in a sense. So what we do is we take stem cells from the person's own body, from your bone marrow, from your fat, we concentrate them, and then we inject them into this area of suboptimal healing, thereby tricking your body into thinking you've had this new severe injury, launching the healing cascade, getting a second healing event without actually having been injured. And that's why stem cell medicine falls neatly into the naturopathic philosophy.
I love it. I was thinking about the journey from whale blubber to self-healing, and I loved going on that journey with you. And it also made me think about, so our last couple podcasts back, we talked with Kate Stillman, who is sort of an emerging expert in the use of urine as therapy. And there were teachings from the tantric pharmacopoeia around drinking your own urine, and what a disgusting thing, right? And now we're seeing the use of using other people's poo to repopulate your microbiome, and like, what a disgusting thing. And I was doing some research before our call, and I came across a website that talked, so Ayurveda was one of the original systems of indigenous medicine, and it was quite involved. We have the drawings of all of their surgical instruments. They were using surgery 5,000 years ago, and a part of what they called it rasayana therapy, they used umbilical cord as the stem cell. And I was noticing that that's not the form that you use, but I think it brings and it's not our intention for the podcast today to deeply understand the science behind all of this. I mean, we can research that if we'd like to, but I think what's more interesting is this idea of society taboo discussed and I don't mean to be conspiratorial, but keeping us from our own endogenous medicine. And so maybe just any thoughts that arise around that whole realm, because I feel like what you're speaking of, and I mean, it touches on kind of what our society is going through now, this idea of how do we heal as a planet, and the depth of the need for this awakening of the individualized medicine, not a one size fits all. And how social, cultural, institutional pressures may actually be keeping us from overall global health.
Yeah, well, Katie, I didn't go into naturopathic medicine because I was particularly cynical about conventional medicine. Right. But 20 years being in private practice, I've become quite cynical. We were talking off camera before we started how my 6-year-old daughter just underwent a major open heart surgery for a heart defect that she was born with, tetralogy of Fallot, which is the most common heart abnormality in children. That is where conventional medicine really shines.
Rocks.
Like, they're amazing at that. Oh, you got a problem with your heart? Yeah, we can fix that. No problem. I mean, it's that, like, so I am the recipient of the best conventional care has to offer. And I'm very grateful for that. When we're talking about chronic conditions, and especially chronic conditions that don't kill you, because that's the thing about chronic pain, is it's the most expensive condition in the world. Like it's the single leading cause of disability worldwide. The cost of chronic pain is greater than heart disease, diabetes, and cancer combined.
Wow.
But it doesn't kill people. So for that reason, it doesn't really get the research dollars.
Wow.
what I've seen, from that outrage that I had over the Twinkies and the food industry, like I saw that, from my own experience, I was being offered these very sort of expensive interventions when something very inexpensive and using my own body's healing abilities, not covered by insurance. Like, it became very clear to me that this is subversive. This is, exactly, you put it beautifully, this is using your body's own ability to heal itself.
Yeah.
And that doesn't fit into the system, unfortunately.
Yeah. Yeah. Another thing that I remember from one of your talks that shook me was, and correct me if I'm telling the story incorrectly, but I remember something about I may be getting the stories confused, but like a cowboy coming in and asking you to treat him with stem cells because they had seen great success with it with their horses. And I'm like, we are treating animals with this and they're having great results, but yet humans can't have this therapy. And just like how strange that seemed to me.
Yeah. So early on, I learned to aspirate bone marrow in 2010. And I knew right away that was all I wanted to do. So I had a bit of a burn the ships approach where that's all I wanted to do. The problem was very few people back in 2010 in the United States had heard of stem cell therapy. So the people who had heard of it were these Wyoming cowboys and ranchers. And the reason for that is because there was a veterinarian up there. The absolute earliest adopters of stem cell medicine were the veterinarians. You want to know what's cutting edge in medicine? Look to see what the vets are doing, because they're the most pragmatic.
Wow.
It's, there's some insurance now for pets and animals and stuff, but for the most part, it's cash pay. And, they're interested in what works. So these guys, owned these very expensive workhorses that would get old and were no longer able to work. And they wanted to get a couple more years out of them. And they would take them to this guy and he would do stem cells in mostly their hooks. It's mostly they get arthritis in I forget the name of the joints in horses. They don't call it a wrist. It's something else.
The horse wrist.
Yeah, the horse, exactly. Which is attached, the horse wrist bone is attached to the horse elbow bone. So, but they would take them to this guy and then they would see with their own eyes how well it worked. The horse went from not being able to work to being able to work. Now, there's some argument as to whether or not placebo effect exists in animals. I believe that actually it does somewhat, but to a much lesser degree than with people. And so like that was the only evidence these people needed. So they would say to this guy, can you do this on my back or my neck or my shoulders? And the guy would say, well, no, I can't because I'm a veterinarian, but there's a guy in Park City who's doing it now. Go to him. So those early days, I was getting a ton of these busted up old cowboys.
I love it.
Ex-rodeo, just like worked hard. I say they exceeded the terms of their warranty. They just worked hard their entire lives. And those were my earliest cases. So what I would do is
did they experience amelioration of back pain?
Oh, they were great. Yeah, they were terrific. Because what's nice about them is they're extremely pragmatic people. Mm-hmm. And they don't have a lot of, like, the fact that what I do is so weird,
right,
doesn't work against me. Like the psychological aspect is real.
Massive.
And if someone is on the fence, I do not want to treat them. I have no interest. And even if their spouse is on the fence, I don't want to treat them, because people can talk themselves out of it. I've had people I know I've helped. Like can you go up and down the stairs now? Yeah, actually I can go up and down the stairs, but it didn't work. I started doing yoga and I'm pretty sure that's what did it. I'm like, oh yeah, 20 years of severe low back pain. I'm pretty sure the yoga did it, in 2 months. But so anyway, yeah, that plays a major factor. And that's part of the reason why I put everybody to sleep. Because we contract with anesthesiologists. Before I started regularly using anesthesiologists, what I found, because the treatment's very painful to go through if you're awake. what I found was that when I would talk to people, they were actually kind of pissed off at me,
Right.
because I had tortured them.
Mhm.
And they were the ones who were saying, oh yeah, it didn't work. I'm like, really? Okay, well, let me ask you some questions. When I started sedating everybody, I just changed the price so it's included. Then, I'd say you don't have to be sedated, but you're paying for it, so you may as well. So then nobody turned it down. That conversation, that sort of like angry icicles over the phone, completely stopped happening.
Well, that makes a lot of sense to me as someone who spent the past 5 years becoming somewhat of a knowledgeable person in the realm of how we release trauma. And the animal body or / the subconscious does not make any differentiation between an attacker and Dr. Harry, a well-meaning person who's hurting you.
Yeah.
And so a lot of the work in that, a part of the work in that field is helping understand how the body, when it undergoes an operation, even with anesthesiology, how it can come out of those states of fight, flight, freeze, which even if you're asleep, our animal body is still awake. And so I think that's really important to take into consideration. There's so much subconsciously operating that directly informs the healing or non-healing response in the body.
Yeah. And that people just like frame the entire experience in a positive light. Like they wake up, the painful stuff is over. They wake up, they're a little bit high. They've got some ketamine on board. So they're sort of emoting and very, I really appreciate you and what you're doing. I mean,
I see this being really helpful for men. They're like, yeah, I haven't had a cathartic cry like this in years. So I think that kind of ties into another thing that I want to talk about, which I think you call I can't remember if it was the yin and the yang. At Shakti school, we say that we practice feminine form alternative medicine, but I really want to alter that because it's masculine and feminine form. All balance in medicine comes from having those two in balance. But why I've leaned so much into the feminine, and it has nothing to do with being a woman, everyone has it, is this understanding that there is an underlying field through which we are experiencing phenomenon, whether it be a disease in our body or an emotion with our partner. There's a field. And so Western medicine and what I call masculine medicine is very wonderful and very needed, but it is addressing the weed. And so what we attempt to do is address the field and the weeds, right? And so maybe speak to your experience. And I think there's a beautiful story I'd love for you to tell about being in South America with kind of a foremost expert in stem cells around the role of doctor and patient in the realm of the heart.
Sure. I'd love to talk about that. So, I agree with you, as stem cell medicine and the way I practice it is probably the most macho form of naturopathic medicine.
I agree.
Exists. And so, and actually, I want to tell you one other quick story before I launch into this, because you were talking about cathartic cries.
Yeah, we have plenty of time. We can go deep, Gary.
And by the way, do you like my Hello Kitty?
Well, I had noticed that.
Yeah. So during those years when I was working with the Cowboys, it was slow here. So what I would do is I would alternate. I would do 1 month here, and then I would go travel through South America for a month. And I had these different doctors that I would do rotations with that wanted me to provide services. And then on the same trips, I would visit doctors who had, vast experience. Because here in the US, when I started, I was one of like 10 people doing it, and nobody else was really sharing what they were doing. They were kind of keeping it a secret. So, whereas the South Americans were like, absolutely, come whenever you want. We would love to have you. Not once did anybody charge me for, they wanted to share the knowledge. So anyway, one of the rotations I did was with this orthopedic surgeon, a wonderful man named Carlos Chiriboga, who's an orthopedic surgeon in Guayaquil, Ecuador. And I would go do the stem cell harvest and preparation, and then I would pass the stem cells over to him, and he would use them in concert with traditional orthopedic surgeries. And I did that for a number of years. But anyway, I developed a close friendship with this man. He was wonderful. He opened an IV clinic and was doing sort of like Myers cocktail type things. And I was just about leaving to go to the airport after my rotation. He said, Harry, let me give you this new thing. It's really cool. It's basically a Myers cocktail with a bunch of oxytocin in it. And I was like, okay, I'm always game to try something new. So he gives me,
God.
How
do they get oxytocin in liquid form?
Oh, you can get it. It's available in injectable form.
Wow.
So he gives it to me, and like I go to the airport, and I'm flying from Guayaquil, Ecuador to Bogota, Colombia. Quite possibly the world capital of machoismo. And I'm sitting in first class by myself, crying the entire flight, like thinking about my mentors and thinking about the wonderful things I blah blah blah, on and on, and I'm just like crying the entire flight.
Harry, this makes me so happy because we're, obviously gender is a spectrum, but I think we can agree for men. I would love if all men went and got that oxytocin injection, and maybe we could go get a testosterone, because I'm like, Harry, this is how I feel for at least a week every month. Now you know.
I know, seriously. I said, Carlos, what did you give me, man? What's wrong with you, for crying out loud? So anyway, so back to the other story. So I had this circuit that I would do. Guayaquil, Ecuador was one, Bogota, Colombia was another, and then 3 cities in Brazil. And the center in Bogota, it is a friend of mine, Carolina Lucena, and she has an amazing story. She comes from this family that's considered a national treasure in Colombia. Her great grandfather performed the first cesarean section in all of Latin America. Her grandfather, that was her great grandfather. Her great grandfather performed the first brain surgery in Latin America. Her grandfather opened the first pharmacy in Colombia, and apart from that, just opened a free clinic for the poor. And then her father, Dr. Elkin Lucena, who's very well known, performed second in the world, first in Latin America in vitro fertilization. So my friend Carolina ran the IVF clinic for years, putting the eggs and the sperm in a dish and whatever they do. And she kind of got bored with it. So with her brother, they opened a stem cell laboratory and did stem cell procedures treating specifically diabetes, which is pretty interesting. It's the only clinic I know of that focuses on diabetes for use of stem cells. So anyway, I was out to lunch with Carolina and the very famous Dr. Elkin Lucena. And Bogota's very elegant. It's a very elegant city. It's a very European city. It's a beautiful city. And so we're at this very nice restaurant, and I'm a little starstruck with Elkin Lucena, and I was, I'm kind of shy anyway. And I'm sitting there, and Carolina says to me, so the reason I would go there is I would do their orthopedic cases, their patients who had hip pain and knee pain and back pain, but also for my patients who wanted culture expanded stem cells, I'd meet them there. And Carolina would culture expand. That means grow it in the laboratory. So now you have hundreds of millions of them. And she said, Harry, how is it that when I get most because she receives these samples, these bone marrow samples from lots of doctors, and when I grow them out, it takes usually several days for the cells to adhere to the side of the petri dish and start reproducing. Your stem cells, the ones I get from you, do that process in a couple of hours. And she said, what are you doing differently that makes your stem cells so happy? And I thought, I sort of had this moment where I had absolutely no idea, like what I really, like, I was stunned. I had no idea. So I sort of did this trick from my rock climbing days where I kind of just quieted my breath and I cleared my mind in hopes that the answer would come to me. And the answer did come to me. I realized what I was doing right there actually was probably it. And I said, Carolina, the only thing I can think of is when I operate, I clear my mind of just sort of like anything other than what I'm doing. I focus entirely on what it is that I'm doing and the reason that I'm doing it. And that's really the only thing I can think of. I said it's a little bit like, es un poco como hablar con tus plantas. It's like you're talking to your plants. And as I was talking, Dr. Elkin Hussein was leaning forward and more and more in his chair. And then he banged his hand on the table and he said, "Sí, señor." And he went on to explain that the reason his outcomes for in vitro fertilization are double digits superior to the industry standard is because when he operates, he projects love onto the entire situation, onto the surgery, onto the person, onto the potential of creating a life. And it was so sort of I was so happy to hear him say that, because I always thought that was this sort of like groovy hippie thing, like sort of a naturopathic thing. So it was very reinforcing to hear a world-renowned surgeon say essentially exactly the same thing.
Harry, I think that more people are doing that than we know, and there's this fear of speaking it. And as you were talking about the story, I was remembering one of my first, and a lot of us do this intuitively. And I remember hearing one of my Ayurveda teachers say, when you sit down with a client or a patient, you are entering into a sacred relationship with them. When you take their pulse, this is as intimate as it gets. You are interfacing with the subconscious realm of this person. And a true pulse master, like a Dr. Ladd, can feel your pulse, and he can feel if the woman who he's taking the pulse is pregnant or not. He can feel the mood that your mother had while you were in her womb. I mean, a master can really interface with all of these levels. And so it is this like deeply holy, sacred thing to be in this realm of healer, whether we're a Western medical surgeon or a naturopath. And so one of the first things that we learned is, before you ask the first question, you find the place of the heart in yourself, you find the place of the heart in your patient, and you feel that connect above you. So you have this, whether you call it God, presence, whatever, and I would add to that the earth below you, and you are entering into this sacred matrix of support that is that field, right, that I was speaking of before. And that interconnectivity of the field, point A, point B, and point infinite, is actually where not logic sits, but magic, right? Like magical things that we call magic because we can understand them, but of course there's an operative underneath those.
Can I tell you one more story in that vein? So another time when I was first learning stem cells, and a lot of my skill as a proceduralist comes from my years rock climbing, because in rock climbing you have to be so precise and you have to be so efficient in your movement that I took a lot of that over into performing procedures. And so in the early on, when I was just first learning bone marrow aspiration, really took me a couple of years to really get good at it. And I remember the time that I did the first bone marrow aspiration where I was perfectly in the flow, like perfectly. The room, like the light in the room was perfect. The music on the radio was perfect. Like everything was perfect. I didn't have to talk to my assistant. We just flowed. And it was truly that flow state for the first time, after 2 or 3 years of doing bone marrow aspirations. So anyway, this gal, she was a Mormon lady. And I said to her afterwards, I said, I got to tell you that you just received what is quite possibly the most perfect procedure I've ever performed, and maybe the most perfect I will ever perform.
Wow. That's a great thing to hear.
Yeah, she was not in the least bit surprised. And she said, she kind of leaned forward and she said, as we speak, there are 30 people at my house praying for you to do a good job. I just about fell out of my chair.
Wow. I want to share this. I attended a funeral over Zoom last weekend. A dear friend of mine's mom passed, and I had known her when I was little, and I would go to their house every Wednesday because her husband taught me the piano. haven't seen this woman, heard from her, talked to her. Love you, Fran, but I went to this funeral because they were important to me as a young woman. And I'm at the funeral, and she was, I grew up Southern Baptist, and so she loved Jesus, but the unseen side of Christianity is the divine feminine that we may talk about in the form of angels, right? Or Mary. And she loved angels. And her best friend told this story, and she was very sick. Some of her life, I don't know the whole story, but at the end, she had to sleep sitting up so that the acid wouldn't bother her. And so they had to lay her down in a what do you call it? A CAT scan, I guess. And the sound that it makes, these huge.
It's very noisy. Yeah.
Very noisy, very scary. And she had to be laying flat. And I mean, the woman that told the story did it so beautifully. But as she was laying there, all of her friends and family were so worried about her. And when she came out, they said her skin was radiating and her hands were warm, whereas their hands were clammy, and they were freaked out. And she said, I was surrounded by angels. The sound of the CAT scan was the sound of their wings enveloping me. And this was right before she died. And they told more stories about her death. But my point with this is she would have never known that story of how she struggled at the end of her life with, is there an afterlife? Is there heaven? And then to oscillate between that and this incredible faith and this incredible love and this experience of being held by angels, and how she would oscillate between the two. It was like a healing had happened for me, right? The question that I had been having that week is like, why me? Like, why do I struggle with X, Y, and Z in my body? I've had chronic health stuff my whole life, which is of course why I got into Ayurveda. And the magic of that story was in the fact that she never would have known that her story would have reached Katie Silcox in Hawaii. Like, she never would have thought of me. But also the healing that happens not only in the quote patient in this realm of the heart, but also in all of the people that surround them. I'm sure with your daughter, you shared that story. Like, it's not just your daughter that's heart is being opened, literally. It's your whole family's heart is getting a surgical treatment with something like that. And so I just think it's such an important reminder that when someone is in the hospital, when someone's going through a challenging experience, it's everyone that's involved that is the healing, that does the healing, that receives the healing.
Yeah, agreed.
Harry, if you, beyond stem cells, as you look out into the wild wilderness of reality at this moment, what would you offer to our listeners, who I know those that they will head to you to find some healing around back pain and neck pain and joint pain, but in general, what would you offer as like Dr. Harry's top piece of advice for surviving this crazy world?
Be kind to your body. I mean, really, that's it. Of my practice, I've been in practice for 20 years. And part of, I had this wonderful experience early in practice where this guy came to me, and he was in his 70s. And I looked at his chart, and I'm like, oh, I definitely can help this guy. And I went out, and this guy was this very good looking guy, but his face was disfigured from what looked like bad plastic surgery. And I was sort of, I was judging this guy. I was thinking, wow, that's weird. Like he's sort of this macho cowboy. He's had all these, cosmetic surgeries, and, kind of making up these stories in my head. Well, it turns out the guy was a Korean War fighter jet pilot. And he had been shot down during a firefight, ejected so these were all burn scars. So the surgery on his face was to correct all these burns. And he landed behind enemy lines, and it took him a week to crawl over into, an Allied base. And, I was horrified at myself for, telling somebody else's story. So I promised myself from that moment I would never tell somebody else's story for them. I would ask the questions, and then I would shut my mouth, open my ears, and really absorb what it is that they're telling me. And over 20 years, people have told me some real gut-wrenching stories about the moment their lives were changed and things that, created, what had them going from like a normal person to being a chronic pain sufferer. So don't do dumb stuff. Don't get up on your roof, like hire somebody to go up on your roof, please. Like, just don't do dumb stuff. Like a lot of it is just these sort of like goofy accidents. Okay, that's one. Be aware when you're stopped at red lights. At this point, after 20 years of listening to people tell their story, I keep my foot kind of off the brake as much as I can in case I get rear-ended. Because if you get rear-ended, you want to actually like accelerate as fast as you can.
I didn't know that.
Yeah, you don't want to just take the brunt of it. Wow. If there's someone stopped in front of you, get as close to them as you can, because then if you get hit from behind, you're not like going like that. Yeah. So
wait, like I want to understand that. Get as close to them as you can.
Yeah, when you're stopped at a light, if there's nobody behind you and there's someone in front of you, get as close to them as you can. Because if you're back here and you get hit, momentum, you're gonna go and slam into them. So you're gonna do this sort of thing. Whereas if there's two cars that are almost connected, then it's going to be a lot less impact to your body. So, I mean, there's kind of like that sort of thing. Then there's weightlifting, chasing numbers. There's this one CrossFit exercise where you alternate box jumping with deadlifts. And that one exercise paid for my house.
Oh my God. Are you guys listening to this? Okay.
Yeah. There is no more efficient way to blow out a lumbar disc than that exercise. So
going from what was it, box jumping to
deadlifting. Yeah. So you're box jumping and you're like spiking your heart rate, and then you go do this most sacred of all exercises, the deadlift.
So there something, would you not want to spike heart rate before you do?
If you're gonna deadlift, just deadlift, and treat it with respect, because it's deadlifting is probably the single most beneficial weightlifting exercise, but it's also the most dangerous. If you do,
is that the one where you go down and then you pick it up and push it up and then you go?
That's different. It's just where the bar's on the floor.
Oh, I've heard myself doing that.
You bend forward, you pick it up, and then you stand up, and then you drop.
I've done that. I've actually done exactly what I have literally gone from cardio to that, and my butt, back, pubic synthesis, like everything was just like, no. Okay, don't do that.
So, I mean, that's sort of like we have like, don't get in a horrible accident, be smart about your exercise. And then there's kind of just like everything else, like emotional balance is critical. Sleep, like more and more, I'm really realizing how critical sleep is. Like in my book, I talk about the 4 pillars of health: diet, exercise, emotional balance, and sleep. And sleep is probably the thing. I am so protective of my sleep. Because that's how you don't get dementia. I mean, there's like so many serious health issues that can arise if you don't take your sleep seriously. So there's that, and then just sort of like across the boards, because if whatever the pain syndrome is, if it's based in emotions, I can't help the person.
Well, it reminds me, have you heard of Dr. John Sarno's work?
Of course. Yeah, he cured my dad. My dad had a severe intractable back pain. Wow. And went to Sarno, and Sarno cured him.
So for listeners who aren't aware, Dr. John Sarno wrote a book. I think it's called
Healing Back Pain Without Drugs or Surgery. He wrote a couple of books, but
he wrote a couple of books. And I had a doctor, I was like spiraling, thinking I had all these different diseases. And this doctor was like, what are your symptoms? And I was like, well, I'm not sleeping. I'm super anxious. Well, I have some bloating. Like I was telling him all my symptoms, and I'm like, I definitely have Lyme's disease. And he was like, you do know that your symptoms are the common symptoms of about 14,000 different conditions, right? One of them being anxiety disorder. And this was like 10 years ago. And he's like, why don't you read Dr. John Sarno's book? And that I read John's, after I talked to that guy, he was an MD, by the way. I have to ask my mom what his name was. It was a friend of our family's. And I'm telling you, that was some freaking shamanic medicine. As soon as that doctor that, you know, I'm a part of society. I grew up with the white lab coat syndrome. And as soon as this doctor was like, you are anxious, little girl, like, let it go, I slept like a baby that night. And then I read Dr. John Sarno's book, and essentially it's like so much of back pain is related to unconscious emotional suppression.
Yeah, I absolutely agree with a lot of his work. You know, clearly because it cured my dad. My dad had a suppressed anger, and once he identified what it was, his back pain went away. The one difference I have with Sarno is I think he takes it to, he says all of back pain is caused by this. Like,
I agree. I think
100% of back pain.
Anytime you say all of anything is anything, my red flags go up. So I agree. And I mean, you know, something like an acute accident situation, and you know, the shadow side, and I think we both have a deep respect for Dr. John Sarno, but the shadow side of that all or nothing thinking is that, and where I've gone often and have to kind of rectify all the time, is anything that's going on in my body is psycho-emotional and quote my fault. You know,
it's easy to start blaming.
Right. And it's like, no, dude, sometimes you just like
got
a UTI or whatever.
There's mind, body, you know, there's mind, but there's body too.
Right. I mean, if you go out into the world, like, you know, you can pick up something and it's not just all mind. And, you know, the German new medicine, I don't know if you're familiar with, they're another sort of alternative healing modality. And the theory is every single thing wrong with you has the root origin in the mind. And Ayurveda actually says the same thing, but the understanding of the mind is vast, right? It's the nervous system in general. And we could go into that. But I think, it's important to address conditions on every front to get the best possible outcome. The physical front, the emotional front, the relational front, sexual front, whatever it is. I think that's why we need to, you know, do everything.
That's right. That's right.
Well,
can I tell you about my tithing program before we wrap it up?
Please. Yeah.
So I had an experience Christmas Eve 2016. I had a stroke out of the blue. And it turned, you know, I was hospitalized, and the surgeon comes into the room and he says, well, the reason we figured out, you know, the good news is we figured out why you keep having strokes. The bad news is you have a bacterial infection of your heart and you require an aortic valve replacement in 2 weeks. Which a year later, I figured out was probably from bad dental work. So anyway, I had this, you know, major cardiac bypass, open heart surgery. Oddly enough, it was like 4 months after my first daughter had her first surgery when she was 4 months old. Wow. So it was a weird year. But so anyway, I had this open heart surgery. And, you know, when you have a sternotomy, when you're slender, it is, you know, I for the first time in my life, I got to experience pain that was a 10 on a scale of 1 to 10. And I was sitting there just like, all right, what's the lesson here? Like, why, like, what is the silver lining? What am I going to learn from this? What am I going to take away from this? Because this sucks, really. And what came to me was that the greatest advancement in medicine doesn't do anybody any good if they can't afford it. Mm-hmm. And my ability to get people out of pain is the greatest gift imaginable. And I need to open it up to people who otherwise can't afford it. So we developed the tithing program, and it's been in existence shortly after that experience, since early 2017, where people who are living below poverty line, first they demonstrate that, we take a look at your taxes. And then once we've determined that, then there's 2 pathways for enrollment in the program. One is combat service veterans. If you serve this country in combat, I'm happy to do the treatment at no charge, no further questions asked. For people who are not combat service veterans, we will do it in exchange for documentation of community service hours. So about one day a month, we do these procedures at no charge, and it is wonderfully rewarding. And the reason I kind of want to talk about it, one is if any of your listeners are living below poverty line, otherwise can't afford it, and they're living with pain, I can treat you. The second is if there's doctors listening to this, please rip off my model. You can look, if you look under at my website and look under like payment, there's a link to tithing.
We'll put a link to it for sure.
Sure. Yeah. Because I learned about it from a woman speaking at a JJ Virgin event who was describing her model, and she finished it with, if there's for the doctors out there, please rip this off because I want you to.
I love it. It's also what Ayurveda, like the format of the Ayurvedic doctor was that the entire, and this is a little bit of a different model, but if they're, again, we do have lots of medical folks that listen, like rip this off as well. Like you would pay the doctor, everyone would pay the doctor a nominal amount every month while you're healthy. And then when you get sick, or if you get sick, you do not pay until you are well again. And so it's incentivized the society, and more importantly, the healthcare providers to bring about health. And can you imagine, Dr. Harry, if none of the doctors in this country got paid until their patient was well, they would be like, yo, Dr. Harry, we got to get this stem cell stuff for my Wyoming cowboys. Like, you know what I mean? Like this model would be incredible.
Yeah, I agree.
Well, we'll definitely let people know about all of your links in the show notes. And
yeah, I have a 60-minute Nick Nanton film. We can put a link there. It's free.
Oh, I saw that film.
Oh, thank you for watching it. Thank you for watching.
Yeah. Anything else before we go? That is
nothing I can think of unless you can.
No, I mean, I'm just so happy that that you're on our podcast. I know our listeners are going to love you. And I'm sure there are people out there listening with back pain, or, we have a lot of women. I'm sure they have some husbands out there like, oh my God, we're going to check this out. So I hope this is a benefit to my community. But I think the bigger conversation is what matters around this realm of the heart. And I just want to thank you for being such a force for that in the medical world. I'm so grateful that you exist, and that I called you a renegade and you called yourself a subversive, and I consider myself to be a little bit of the Ayurveda rebel in this world. So I understand that, but I thank you so much, Dr. Harry.
Thank you, Katie. This has been a pleasure.
Likewise. Thank you.
फूटे फूल अपन सुखे फूटे फूल